In Uganda, 1.4 million people are living with HIV. Adolescents and the youths are more affected. Specifically, in northern Uganda, the HIV prevalence is 7.2% higher than the national average of 6.2%. In Lira district, the numbers are exceptionally high. This is because the district is a bustling business hub and increases the chances of young people getting infected. Sandra Akello is a young person living with HIV in the region. She only learned about her HIV-positive status in 2014 when her mother passed away. Her aunt took her to YAPS Health Center 4 to get tested.
I remember one day when I was in P4, I asked my mom that why do I always swallow medicine? If I'm not to forget, she used to just buy for me the medicine, and that was Seprin. I was not on medication. But still, by then, I used to fall sick. I could stay like a week and I fall sick. And in P7, when I fell sick, my aunt came up and took me to the health center. And that was in YAPS Health Center 4. They had to test me, and when they tested, they found out that I was positive.
Since 2018, the USAID-funded Regional Health Integration to Enhance Services North, Lango, has been working with the Ministry of Health to reduce HIV-related stigma and discrimination, which is responsible for the low uptake of HIV treatment among young people. The project introduced the Youth and Adolescent Peer Support Program, also known as YAPS, where youths are trained to provide referral services, life skills training, and peer-to-peer support for adolescents and young people living with HIV. YAPS ambassadors like Sandra support fellow peers to get tested, get on treatment, and stay on treatment.
There was an advertisement that they wanted to recruit more YAPS. So the sister was like, Sandra, even though you're studying, you go for the YAPS because I can see you're working very hard. Yeah, so I applied. I could go and in fact like providing services, because I felt like now even me, like in our community, people know that for us we are positive. Whenever you're working in that clinic, they know. We could carry the condoms, we take to the people in the community, such kind.
Sister Emily Awilo is a senior nursing officer at the YAPS Health Center 4, the same health center where Sandra was tested when she was just 14 years old. Sister Emily has seen the impact of the YAPS program over time.
Yeah, the introduction of YAPS by the RHITES North Lango has brought quite a number of changes at the facility and the HIV clinic at large. One, as I said, there was poor linkage. Now, there is physical escorting of clients who test positive from different testing points into HIV clinic. We have assigned YAPS who stay there and wait for those who are tested, those who have been identified positive. They are physically escorted up to HIV clinic.
This peer-to-peer approach has empowered adolescents and young people living with HIV to become change agents in their communities. In turn, they have also supported the work of health workers by increasing access to treatment for HIV patients.
The young people are now free to come for the services which they were fearing, like coming for HIV counseling and testing.
Me too, when I talk to my peer, they do understand, and that's why I'm happy in my tracking tool. At least ever since I entered being a YAPS, the peers that I've been talking to, I like us to be sincerely, 15 of them are suppressed.
Like Sandra, Sharon Amongi is a young person living with HIV and a YAPS ambassador. She's also helped young people accept their HIV status and live positively through counseling.
Currently, I can now test, yet I'm not a medical worker, but I was trained how to test. Currently, I can train my peers on the stigma and discrimination, on how to disclose on sexual reproductive health, on how to manage opportunistic infections, on how to live with HIV normally and freely.
Even though I reached 24, that I would not be among the YAPS, I'll still help them because I want to do counseling so that I can counsel them. I know the situation they're going through, most especially those at school, because I know what I went through is what they're going through.
89 young people from 29 health facilities were trained by the USAID RHITES North Lango project to offer HIV services under the YAPS program. Collectively, the YAPS have reached over 6,000 adolescent and young people living with HIV since 2019.